Well, May is Huntington's Disease Awareness Month, so it's a good time to open up the dialogue and talk about this disease, which has no cure, by the way. Joining us today is Bonnie Hennig, a clinical therapist for the Huntington's Disease program at the UConn Health Center. Bonnie, thanks for joining me.
Thank you.
So let's start off by addressing this disease. What is it, and is it only genetic?
Yes. Huntington's disease, or HD as it's known, is a rare inherited brain disease. And there are 3 different types of symptoms that you might find in people who have Huntington's disease. I teach people to remember those symptoms with the letter M. The first one is mood. Sometimes people have mood or personality changes. That can be anxiety, depression, or even irritability. And the second is memory. Sometimes people have difficulty organizing and planning. They have trouble remembering, concentrating, or thinking. And sometimes their judgment can be off. And the third is movement. There is an involuntary movement that can go along with Huntington's disease, and that movement can be chorea, which is like a dance-like movement, or a dystonia, which is a twisting and a holding movement.
Okay.
And right now, Huntington's disease, as you mentioned, has no cure. It's a slow-moving disease. It does eventually lead to death, and we can treat the symptoms.
So that's what I was going to ask. So what is the treatment? What kind of care does someone with Huntington's disease need?
Right. Well, they need a lot of care. And we're very lucky here in Connecticut because we do have right at the University of Connecticut Health Center a whole Huntington's disease program. It's really the only one of its kind in the country. We offer free care 5 days a week only to people with HD. And that type of care and treatment is medication, counseling, and we do a lot of work with family members to try to help them cope with some of the behaviors. We also do research at UConn, and we are involved in clinical trials there as well.
So those are just a wealth of information as far as resources, not only for the person who has the disease, but for the family as well, because it does become a family issue. And as you mentioned, it's genetic, it's inherited.
That's right. So we really do meet with families. We meet with children. I talk to children and families about coping, a child coping with somebody with Huntington's disease in their family, and teaching adults to talk to their children about Huntington's disease as well.
Does it ever happen when families are not aware that this is even an issue and they just think maybe perhaps the symptoms that they have are attributed to something else? Does that happen?
Yes, once in a while it does happen that somebody says, we never even knew Huntington's disease was in the family. And that's really scary. Sometimes there are people who say, I've lived through multiple generations of Huntington's disease, and they see a grandfather, a grandmother, a parent with Huntington's disease, aunts and uncles. But once in a while, because either people were not talking about Huntington's disease or they weren't diagnosed with Huntington's disease, they think that it just pops up, which it doesn't. It is inherited. So
you mentioned the symptoms and the effects. So if you suspect maybe someone in your family or you yourself, you should see a doctor right away.
Yeah, you should talk to somebody. Although the things that I mentioned in terms of some of the symptoms are things that we have in general population as well. So if somebody's depressed or anxious, or if somebody drops things all the time or is clumsy or forgets things, that doesn't necessarily mean...
kind of, to me, the key.
Yeah, that's kind of a giveaway. Sometimes if people do have this chorea, there are a lot of different movement disorders. But if people do have a history or they are questioning, then they should see a physician or give us a call over at UConn.
Great information, Bonnie. Thank you. And a Huntington's Disease Symposium is being held at the UConn Health Center in Farmington. It's going to be Saturday, May 19th. It's from 8:30 in the morning until 4 p.m. You can call this number here. It's 860-679-4919 to register. Best of all, it's free and it's open to the public. Free help there for you. Thanks.
Thank you.